Welcome back to another episode of Mind Your Mouth podcast. I'm Melissa Mugno, your host. And as always, we're going to get deep and have another great conversation with an amazing surgeon in the airway space. Dr. Alfi, welcome. Thank you so much for joining me today.
Thank you, Melissa, for having me. I love that
Absolutely.
name, Mind Your Mouth.
Thanks. Well, the joke is that Melissa the Mouth, I never shut up as a child. And I've always had all this like grinding and clenching going on my whole life. And I had a bunch of issues in my mind. So I'm like, it's a perfect
It was.
correlation. So yeah, when we came up with it, I was like, oh yeah, that's pretty much, that sums me up.
Yeah, I like it.
Yes. So I have to tell you, when I see you on camera, you are like an energy. Like
Yeah, I
you
appreciate
got a
that.
whole vibe.
Thank you.
Your content is fire, to be honest. I've been in this space a while, about 13 years, and there's been a couple moments in the airway space that have been instrumental. Like you knew like change was coming. It was
Mhm.
definitely when Zoggy popped on, like 2016, that you knew there was a massive shift happening.
Mhm.
And I can't tell you enough that I feel the exact same way with your stuff.
I
Like,
appreciate that, Melissa.
yeah, it's edgy, it's
Mhm.
clear, it's confident, it's got charisma, like all of this stuff. And I got to know why. What makes you different?
I don't know. I think the reps, the experience treating a lot of patients. I'm passionate about it. I'm passionate about this message and mission. I feel like it's more than a surgery, more than an operation, and I feel more than anything that medicine, I went to medical school, I went to dental school, and I wanted to get people healthier. That's why I did this. I've always been interested in health since I was very young. I remember reading Men's Health magazine when I was in junior high, just fascinated with all of it. And I realized at some point that we're not making people healthier. We're giving them a bunch of pills. We're ignoring things that are really important. And a lot of it is common sense. So now, mind your mouth is perfect because a lot of it starts with the mouth. And it's amazing how clear it is. Once you see it, you can't unsee it. That so much of health is tied into breathing and sleep. And it really starts with the mouth. So I'm passionate about this message. I do a lot of operations more than anybody in the world. Been doing it for a while. So experience with seeing patients, seeing transformations. I think that's really helped me understand it at a very clear level. And I think that's how I'm able to communicate it.
So obviously, as I doing research, and for some of the audience to know, I feel like I know you. I think we've been passing in
Yeah,
space.
I
We
feel
have
that
some
way too.
patients. Yeah, and I actually don't live far. Like, I mean, I know you're mainly based out of Houston. I know you're all over the place right now, but Houston
Yep.
is home, right?
Right.
The universe somehow dropped me in Louisiana, this Jersey
Yeah.
girl who got
Okay.
lost. And we've been able to have some patients and stuff like that. But the podcast's been out about a year now, right? And you
Right.
went from like what, 0 to 300,000
I
followers
know. Pretty
in
fast.
1 year.
Yeah. Yeah. Unexpected. I think people are thirsty for this information. I
You
really
know,
do.
they're thirsty for it in a really simple, digestible way.
Yeah, that's true. There's so much confusion out there. I mean, most of the providers are confused.
Yeah, isn't that the truth?
It is. I mean, I'm involved with a lot of, you know, continuing education, even talking to our national organizations and different residency programs. And there's a lot of confusion with the professionals. There's just a lot of
I Are you saying
misinformation.
that kindly? You're using a nice word as of confusion. I appreciate the language you're trying to use. There's a little bit of just straight up resistance too, right?
There's some resistance for sure. For sure. But the interesting thing is like the patients are starting to become knowledgeable and aware, and they're seeing through that resistance. And I think that's why this paradigm shift is happening at a rapid speed. And I think that there's I've been in this space like you for some time now. I've been an advocate for a long time, and I see a huge difference 2025 compared to 2023.
Yeah.
Even a
I
year ago, it's like exponential. And I think that, the information is so easy to grasp and understand and so logical that the patients are seeing through that resistance. And I think that's what's going to change these resistant doctors because they're going to be forced to open up their eyes.
One of the things I'm an analogy queen. I say that's the only way I learned from, with all my
Yeah.
ADD and ADHD. What reminisces or like I feel like is it reminds me of this time is like when Invisalign first came out. There was
Yeah.
so much resistance to like it was a fad, it wasn't gonna
Right.
last, right? And we saw a
A great
line, right, market in such a different way. And I
hmm
think it's naturally fear, right? It's a fear of
for sure.
change.
Yeah.
And then with that, and now having and right, Align did something very different, and they chose to market direct to the consumer instead of just stopping at the dentist.
Right.
And when I say when I'm watching your content, I really do feel like a doctor can watch it and absolutely know that you're speaking from a place of authenticity as well as an expert in the space. But
hmm
as a patient and a parent, there's such a like a connection to it, right? It's
Right.
really, really digestible, really fun to watch, the colors, the whole thing of it. And
Yeah.
so did you always wanna get, like, education? Obviously, most doctors have a passion for education,
Yeah.
but what made you say, "Okay, I'm gonna change the whole kind of vibe or lens and really put yourself out there?" I mean, I'm assuming you didn't have to do that.
Yeah. It's true. And it's not my nature either. I'm
Oh,
pretty
really?
shy and reserved by nature.
That's interesting.
It is interesting, right?
Yeah, 'cause
Um,
you do not come off that way, you know what I mean? Like,
I'll
on
yeah, it's
screen or
been a
the
lot of
content.
work, but I do believe in conquering your fears and stepping out of the comfort zone. It's one of my main drivers too. The Mamba mentality, be the best version of yourself every day.
Every day, yeah.
I try to embody that, and I knew that I don't like public speaking. I don't like putting myself out there, but I got to step out of the comfort zone if I want to grow. So that's been my motivation to do that. But it was really about delivering the message. I recognize that, it's a powerful message. There's a lot of information there that's hidden. It's not known. It's hard to find. And as I started gaining more experience and realizing at some point that I am an expert in this, that it's important for me to share. And then it's all positive reinforcement from there. We started with Instagram doing it and then TikTok. And, a lot of wonderful things happen. One is that patients got exposed to me, referring doctors got exposed to me. And that's been great for business. But the really nice thing is the patients are coming more and more educated because they're digesting
Right.
this information, they're learning about it. And, you know, when I sit down with the patient now for the first time, their starting point is like at an expert level compared to before where it's hard to get through someone where you're telling them something that they've never heard for the first time. It's not going to register as well. So now the experience is completely different. Not only are we recruiting more patients from around the world, but when they come in here, they know more than a lot of my colleagues know.
Yeah, the level of like, it's like you almost took the volume and, like, turned it down on the fear level of jaw surgery.
Yeah.
I don't like, I don't wanna say you made jaw surgery cool, but in a way you kind of did.
Yeah. It
Jaw
looks like
surgery was like a no-go, right? Like, that's a fear zone.
yeah. Yeah. That's a big thing. Even when I started doing surgery, I used to talk people out of it.
So did I.
Because yeah, it took me 7 hours to do a case. And the results were there were difficult recoveries, results were unpredictable, and that's a reality of what jaw surgery has been like. So it wasn't a cool option.
Yeah, and
Sure.
it really, the first patient I really collaborated on with
Yeah,
for a double jaw surgery. Amazing mom, female, really cool. She had a good mindset, right? So the
yeah,
first one we did, it was the right time, right patient, all things were
yeah,
all fired, all cylinders firing away there. And I thought, okay, this was a really good outcome. It was a pretty more traditional style jaw surgery, class 3,
mhm,
and I got a little comfortable. It was almost like, they said it made me feel like, "Oh, this wasn't that big of a deal." And then 3 patients after that, I mean, just to dive right in, mental health. I mean, the
yeah,
fear, the anxiety, the amount of phone calls,
mm,
talking off the ledge, not only from my front desk team and from me
yeah,
being the behavioral side, but then speaking to the surgeon. I mean, what a, I don't want to say drain, but the more me and the office talked together, the better we were able to support the patient. But man, if there was any lack of
Mm,
communication, you're talking just the amount of drain on the resources of every aspect to
totally.
try to keep it was really a very intense situation, to be honest. And
Mm,
then after doing a couple more, it was like, wait a minute, if we don't really spend time on the mental health aspect of this,
mm,
I mean, you guys could do textbook perfect
yeah,
procedure and it still goes sideways. And it felt like, well, that requires a lot of expertise on all three, kind
for
of
sure.
areas, right? Structure, function, and behavior. So I
Mm,
realized you really needed to like all surgeons had to have a really stellar team to be
100%.
able to manage that.
Yeah, 100%. I mean, I saw that early on too. The most difficult times we had with patients' recoveries were never the ones that had difficult physical recoveries or even or complications. It was really more of a mental game that was difficult because it's hard to fix or find a solution for those things. So mental is such a big part of it. And I talk a lot about mindset. And we have a psychiatrist in our office that sees all our patients before surgery. We have a nutritionist that sees all our patients. And I have all my patients see a myofunctional therapist because I think it does take that team to hit them for all angles. And we're seeing that it is making the operation a lot more cool because people are getting healthier and they're having the support they need.
Well,
And
yeah, just your testimonials alone, they sound
mm,
different, they feel different. So
yeah,
obviously it's a real right, you're like a 3D approach, right? You are hitting it
correct. You
from
gotta
all
get
the
it.
aspects.
Yeah,
S
exactly.
So for some people that are, like, not listening or for a lot of my myofunctional therapists, what makes your surgical technique so different? Like, besides just that approach or what would you say are some of the real big, like, little
The
golden
biggest thing.
eggs?
Yeah, I mean, the biggest thing comes from experience for sure, because I've been doing it for 13 years. Now I do over 200 a year. So, and it's all I do. And the more you do something, the better it gets on all levels. You see things differently, you anticipate things differently. You recognize that it takes a team and patients need different things. So some of it just comes to simply as I do a lot of them and I've been doing them for a long time. And
10,000 hour, 10,000 hour. Yeah.
exactly. Yeah, it does.
Yeah.
And there aren't many people that can even come close to those numbers. So that's a big part of it. The other part
Repetition is key, right? Repetition is
for
key,
sure,
discipline in your practice.
for sure. And focusing on that operation. I know a lot of people that like to dabble in a lot of different types of procedure. Like, there's some people that are doing breast implants one day, jaw surgery the next day.
Mm,
I have some colleagues that do this and they're good, talented surgeons, but it's hard
to master
to master
one.
them. Right. So I
Yeah.
dedicate all my energy towards jaw surgery. And when you dedicate it, that's all I talk about. That's all I think about in terms of the resources that patients need and how can I make things better, that mama mentality. So every time I do a case, and I've done this for, since I started my careers, what did I learn from this case? What can I do differently? And what steps make sense? What steps don't make sense? And in that process, I was able to change the way we do the operation. So I started using the custom workflow, which
Mhm.
started 7 years ago. It's still rare for surgeons to do it, although it's becoming more popular. But we've been doing it for 7 years and really helped design the protocols and process. So I understand the workflow with the technology really well, and custom
And
work.
just for some people that are listening, the custom flow is that you are actually having 3D printing create,
Correct. The
right? Like, it's very customized.
Yeah,
It's very different for a lot of you guys that are just do you mind just sharing a little bit about that technique?
yeah, for sure. So most people now plan surgeries on a computer. That's the standard now. It wasn't the standard when I started training, but at least that's the standard now. And then what most people do is after they plan it on a computer, they go into the operating room and do it the traditional style, which is they wire the mouth shut and then bend plates manually in an operating room to secure the bone positions, and then unwire, then do the same to the other jaw. But with the custom plates, we're able to not only plan on the computer, but then design and print the plates that are going to secure the position and take us to that position. We print them with a 3D titanium printer. Not here in the office. We outsource to a company that prints it in Belgium. But what happens is when I go to the operating room, the plates are already there to take me to the right position. They're printed specific to be flush with the skull bone. So it's precise, it's accurate.
I was
And then
gonna say the amount of control that you have is
it's perfect. It's precision.
yeah.
So in the operating room, there's no human error at all. It's just whatever I plan, I'm going to get in the operating room. And then the workflows from that become much more efficient because I don't have to wire the mouth shut, unwire the mouth shut. I don't have to bend. I don't have to troubleshoot. Everything is just efficient. So it's not only better outcomes and more precise, but it's way more efficient. So I'm doing these operations now in an hour on average instead of the 7 hours that I used to do it. And that's obviously helped the recoveries a lot because stretching and operating for 7 hours versus one is not 50% better. It's 700% better.
Yeah. That was actually the one thing, just even chatting with, working with a couple patients that we've collectively,
Mhm.
the level of outcome, like the recovery isn't as trying on the body. It's not as
Yeah.
sore. It's not as intense. And then all of a sudden that almost gives them this like confidence that actually
Mhm.
allows the healing process to even go faster.
Exactly. Because that mindset is so important.
So important. And then there's this like level of trust that
Mhm.
I have not seen. Like, I almost want to say to you that I've been taken away. I've worked with a fair amount, and I'm
Mhm.
not, this is nothing against anybody. I know that there's so many variables, but what I've been seeing in yours is the consistency in the process,
Yeah.
right? So, like, if you say one thing, it's going to like boom,
Exactly.
boom, boom.
Yeah.
And then all of
Predictable.
a sudden you're like lowering that fear. And
Mhm.
now the patient's like, okay, these people aren't joking, or like they know what they're doing. They're dialed in.
Right. Exactly.
It
It's
changes
real.
everything.
It's fact. It does change everything to the point where I recommended it for my brother.
Well, okay, like, let's even go there. I'm like, then I'm looking and I'm like, "No way." At first, there was a moment I was like, "Is that his okay, that's his brother." I'm like, "That's a big deal because
Yeah.
the hardest thing to do is to treat family in general. I
Mhm.
mean, right? It's usually the one thing they tell us not to do or, like, don't do it. And, yeah,
Yeah.
so do you mind sharing a little bit about, I mean, that's so personal, like, so
Yeah.
personal.
Not at
Yeah,
all.
what first of all, what can we talk a little bit, like, what led you to even like to even have that conversation with him? I mean, I know you've done a
Yeah.
podcast with him, so his story is
So,
shared.
yeah, and Johnny's here. He helps run our business.
Okay.
And he was with me when I was at Methodist Hospital. He was a surgical planning engineer, basically.
Oh,
So back in the day when we used to plan these things on the computers, he was planning surgeries, preparing all of them at a real software engineer level. So he understands cephalometrics and the surgery better than
most.
most people. And then being in the practice and being part of everything we do here. We see 1,000 new patients a year and we see
Wow.
over 200 operations a year, just double jaw surgery. So he's here seeing all these patients talk about their amazing transformations and what they were dealing with and how much better things are after surgery. And he sees happy people all the time. So it's actually he came to me finally at one point and said, "Okay, I want the surgery. I want to have it." He gave me a date. I want to have it in November. And I was like, "Okay." I mean, I know that he's having difficulty breathing through his nose, like most people do. We knew that he was a little behind recess on his upper jaw and lower jaw. So he was a good candidate for the operation. I knew he would benefit from it. And ever since I was a resident, I was treating family in oral surgery. So, when I was a resident, I did dental implants for my mother, my father, my aunt, my uncle, then my med school classmates and other residents and even attendings were coming to treat me. So at an early part of my training, I became very
That's a
comfortable.
real that's a real testament to your character and the level of
Yeah.
like, because, to be able to hold boundaries and you know what I mean, and be able to level and still, well, one, you also have to be pretty good at what you're doing because they would be able to find
Yeah,
out if
for
if you
sure.
were not doing
For
great
sure.
work.
Yeah, it's true. So,
Um,
starting from that part, even with smaller procedures, you're right. People trusted me and I trusted myself that of what I could do and can't do.
did you
And
always have that trust in yourself?
for things that I knew I could trust myself with, yeah.
Yeah. So
Yeah.
when you've done the work mentally, mindset, whatever it
Yeah.
is,
Yeah. I'm
you
the
don't look
biggest
back.
critic of myself. So whatever, if for example, with this jaw surgery stuff, anyone that thinks they've read something, went down the rabbit holes, I've gone deeper. Like if I'm in something, I'm gonna be all in with it. And
Which is
you
a good characteristic of your surgeon. You want your yeah. If I
know,
want you to be obsessive over something, I
yeah,
sure want you to be obsessive over, doing something on somebody's on their
absolutely.
mouth and jaw.
Yeah, it's never something I took for granted. I always took that responsibility so hard, even as a resident student. So when I was going to do something, I wanted to make sure that I was never a charlatan. I was never just flying by. I wanted to make sure I was going to be, the most knowledgeable in whatever I was doing. So I
Whatever,
think
yeah.
you did give me that confidence, and then I still act that way today. And then in training in the medical center, probably most of my patients are physicians in the med center that I know. I at least have my patients since I started here 13 years ago. So I became very comfortable treating friends and family and people within our community. So yeah, when it was my brother that wanted surgery, one, I wouldn't want anyone else to do it because I have that confidence that I think I'm the best at it. And I don't say that lightly. I say that because I know I've put in the work. I know the level of attention and research and homework and all the dedication I have to it, and I know what everyone else is doing. So I
Yeah,
wouldn't
the
trust
level
anyone else to do that
yeah, the confidence
for it.
is there, which actually kind of brings me to a conversation that something I really did wanna chat with you about and want your take on it is that, myofunctional therapists in general, they really, whether they meant to or not, they become the bridge. I mean, even you and I, there was a case that
Yeah.
a patient was pushing me to say they wanted to do a sleep endoscopy or something like that. I reached out
Mhm.
to you, you were, saying no, which I totally respect and I absolutely see why not. And you said I don't need to.
Mhm.
But, as therapists, there's a lot of us that get put into this bridge category, right? We're advocates. We're almost
Yeah.
kind of trying to present them to you guys on platters. We're trying to do all the prep work, really like
Mhm.
volley and serve together. But surgery or jaw surgery in general, definitely when they ask us, I mean, Sarah and I, when we're teaching and stuff, they'll come in this constant question of like, well, should they do expansion versus surgery? Or, should they do MARPI? Should they do SARPI? And how do I know or how can I support somebody in that? And so if you wouldn't mind, would you be open just like kind of share a little bit? What's the screening process? When are you going one way or the other? Or do you pretty much clear like jaw surgery is really probably the better answer? Or where is your philosophy and mindset on that?
Yeah. In terms of like algorithm, where
Yeah, just in general, like,
everything.
yeah, or I can even use my own self, right? Like, here's an example. Like, you
Yeah.
sometimes when you're in the space and you know too many people. So
Yeah.
I have typical UARS, a lot of clenching, a lot of grinding.
Yeah.
I've always felt as though the vertical of my bite is too short, and especially from
Mhm.
all the grinding. Half the docs say jaw surgery. And other one's like, nah, you could do MARPI, you can do SARPI. I've done a lot of mental health support. I've come off all
Yeah.
my pills, worked on my mindset. I think my body is finally, the inflammation is decreased, losing weight. I'm in the right space. But, you know,
Right.
I think there's a lot of people in my exact space that go,
Okay.
ooh, God, MARPI is hard, but it seems easier than the jaw surgery, result candidate. I mean, I know there's no perfect one way or another, but
Yeah.
just curious for the therapist and myself to just hear
Oh, I
how you
think
would talk this out.
yeah. I mean, it's tough because, and I understand this when I deliver this message, that not everyone has access to the way we do surgery here.
Absolutely.
And I have to take that to consideration because, 7-hour operation done the traditional way, I still don't want to recommend that. But the reality is that that is what people have access to still in majority of the world. Right. But when I see patients here and I know that we can deliver an operation in an hour, it's predictable, it's stable, at least for my patients, it's a different kind of thought process because the way I think about it is almost everybody is recessed, that especially if they're narrow. It's very rare that we see someone that's just has a narrow maxilla, but everything else is in a good position. Right. That's
So,
that's a
yes,
rare
you pretty much see everybody's recessed, right?
everybody.
I mean,
I mean, if you have your wisdom teeth removed, that means your jaws were recessed. They didn't have room for the wisdom teeth. I know it's a simplification, but it is as simple as that. Or we should have room for our wisdom teeth. But the reality is that 95% of people don't. So, they're all recessed. There are exceptions, right? When I say all, I don't mean 100%, but I mean the
I mean,
majority.
it's pretty up there. I
Yeah,
think it's a fair thing to say that there's more people without wisdom teeth than with wisdom teeth.
100%. So what happens is, that's important for breathing, and breathing is so important. It's a fundamental foundation for health and especially sleep. So I look at it as a tool. If you can bring somebody forward, rotate them counterclockwise, expand their jaws, all these things, that's the optimal, to give them as much room as possible. But we just have to weigh it for every person, you know, how much is worth taking on in terms of all the factors, finances, risks of surgery, time down and recovery and all that stuff. So
But in a
first,
simple theory, most people that are
they're going to
candidates,
benefit from double jaw
they're
surgery.
gonna benefit. They
Yeah.
are. Okay. That
And
yeah, which
especially,
what I was saying sorry, didn't mean to
yeah.
cut you off.
I was going to say most of my patients are back to work in a week, if not a week, in 2 weeks, and it's a safe operation. It's predictable, it's stable. So for people that are here that they have airway up UARS or trouble, we're going to want to bring them there. Now, the decision of MARPI versus SARPI versus double jaw surgery with expansion versus not, it's just weighing everything together. If somebody is a little narrow, but their bite fits together, then to me, it makes sense to bring their both jaws forward. That's going to give them the tongue space they need. You can do Invisalign to expand 4 or 5 millimeters pretty safely for both upper lower arches and get more tongue space that way. And then that way you avoid surgical expansion, another year of MARPI, and still going to get all the benefits that we're looking
Which is a very big testament to how you work in general, right? Like a nice flow sequence. And we
for. Yeah,
all want as much. I think the thing about this airway space in general that I'm always very aware of is that it's hard for patients because we don't all have a great consistent guarantee outcome.
of course.
There's all these
That's
movable
like,
variables,
yeah,
right? You're talking about human behavior, you're talking about all these things.
sure.
And it does seem with what you're doing, it's kind of consistent, right? Like you can kind
Yeah,
of guarantee that outcome. And there's something comforting about that. It says, hey, you do this, you do that. I know I can get you here.
yeah,
Like
for sure.
from a foundational standpoint, right? There's something really like pleasing about or, intriguing about that.
Yeah, for sure. I mean, I know I can, if they're snoring, there's with confidence, I can make them not snore. If they're having trouble breathing, they're going to breathe better. And if they have sleep apnea, it should improve. Whether it cures it or not, there's variables there, but
Of course.
I can pretty much guarantee that those things are going to happen, and then they're going to look younger and better too. I mean, that's what
Well, they
happens.
just look like a better version of
Yeah,
their self, right? Like just their
exactly.
fullness in their face.
Yeah, I
Yeah.
love it. You said the Mambo thing.
Yeah,
The
absolutely.
beneficiation of themselves.
Version of themselves. Yeah, that's
Yeah,
always what it's about, right? No one's
100%,
broken. It's just how
for
do I
sure.
get you to be the best you so you can optimize and just
Yes.
put out to the world. Dr. Kimberly Santiago, good
Yeah.
friend of both of ours. I've known
Yes.
Kim a really long time. I said this to her after watching her on the podcast. I sent her a text. I was like, I am so happy to see your inner light beaming again.
Yeah.
Right? Like I I've just seen her. She's actually coming on in a couple weeks. And
Yeah.
it's like she was able to take back a little bit of that vibrance, that
Yeah.
amazing, just natural flow that she's always had. And I thought, wow,
Yeah.
like everything, it's not just one thing, but man, when the pieces all come together, it's
Yeah.
really fabulous to
It is.
see.
And there's no doubt those things are, put someone in a positive direction. And we have
Well,
mutual, Kimberly and I have mutual friends, and they'll tell her, "Oh, you're so much more chill now, or not as irritable." And she's like, "I am," but it's like, yeah,
well, which, the ADD, ADHD
yeah,
connection, right? For me, I mentioned to you when we first started, I'm a 81 baby, so they didn't throw me on Adderall until like end of high school, so I at least got through some of the development aspects of it. And then I was already pretty high fight or flight kid, environmental situations. Now you
mhm,
just hock me up on some good old Adderall and now I'm like really up here, couldn't really control my emotions anyway. And then naturally was always told, oh, you're sensitive, you react, you're this, you're that. And I remember so internally feeling so trapped within my own mind, my own body, feeling like a true prisoner of myself, like, but yet trying to function like I'm a regular person, you know?
Mhm.
And they just kept giving me more meds, more meds, more meds, more meds. And I got to a place, remember thinking right before I turned 40, wow, I'm on a lot of antidepressants. I'm taking Adderall. I'm still depressed, but up on the outside, life still looked good. I'm
Right.
teaching other people how to sleep and breathe. I was up and down in yo-yo weight. Like my body was just keeping weight on left or right. And the only thing I could do at that moment, went to a couple of my good surgical friends and they were like, "Melissa, we don't even know what surgery, like your body, I don't even think will respond properly right now, right?
Mhm.
You're so inflamed." And it led me to go down an alternative route where I just needed to do something very I went down the psychedelic route. I went
Mhm.
down the route of like I needed to get off all the meds
Yeah.
and just to find myself a little bit. And
Mhm.
all of those different retreats I went to, everything brought me back to this one thing, and that was the fact is I had no clue really how to quench my own breath, how
Mhm.
to breathe. And when I slowly started unpeeling and unraveling things, I realized that my central nervous system, on top of environmental stuff, was just this like live wire. You know what I mean? Like it just no matter
Yeah.
I couldn't process on a even keeled because I was reactive, and then my body was responding to these things. And I think of how many patients we end up
Yeah.
like that, where now, yeah, I'm really lucky I was able to deal with the functional side and the behavioral side. And now I feel more ready to take on the structural approach
Right.
because I'm a better candidate now, right? I'm a better candidate for everybody, not even just for the surgeon, but for myself.
Yeah. And that's so important.
And I think so many patients feel really trapped in their bodies. And I know for a fact that you and your team are dealing with patients like that. Hence you saying you have a psychiatrist and a
Yeah.
psychologist on team. Are there I mean the correlations between mental health, ADD,
Yeah.
ADHD, like what are some of the things I mean, obviously we're just talking about, Kimberly, but other people, is this a common thread you're seeing in a
So
change in
common.
them?
Yeah. So common. And it's a tough because it's a loop, right? It's like bad breathing and bad sleeps makes people anxious, depressed, throws them off their game. I mean, irritable, could influence their mood. And then the longer that persists, it starts to define who they are in terms of personality. So it's hard because, maybe the sleep and the breathing may affected all those things first, but now those are things we have to deal with. So understanding that those are such a powerful component of the sleep and breathing, I think is really important. And then trying to tackle it. So it's not like someone is anxious, depressed, and just gonna expect it all to be fixed with a structural component. It's not realistic. What happens is, shockingly, we see a lot of people with anxiety, depression come off meds and feel a lot more anxious, a lot more less irritable. That happens all the time. But I do think our best success when it's intentional. People start working on positivity, mindset, eating clean, focusing on sleep hygiene. Once you put all those things together, it's really powerful what the outcomes have been. And I think that's something that earlier in my career I wasn't really paying attention to. I was paying attention to the surgery and operation itself. But it's as simple as if I fix a structure and then you go home and you're not focusing on the hours of sleep, the conditions of the bedroom, drinking at night, all these things. The structure doesn't matter, really. I mean, if you're wrecking if you're not sleeping or you're wrecking your sleep, doesn't matter if your structure is good because your sleep is still wrecked. So understanding that, at a very deep level that all these things matters, we're seeing such big differences. And it's interesting, the more I talk about these, I feel like patients are coming to us now preconditioned to be better versions of themselves. I'll have patients volunteer information to me. And the first time I meet them, like, all right, I cut out alcohol, I wear an aura ring, I started tracking, trying to get 8 hours and doing all these things. And now it's like, I love this because these are patients that I know are going to do so well after surgery.
Because they're taking some like they're responsibility, but they're slowly moving out of that victim mindset, and they're realizing that there's things that you can take on. And I don't say that like because I ever want anyone to feel bad, but
Right.
it's easy to get into that loop of this is all happening to me. It's
Yeah.
right. And when you get into that spiral, the sad part was there was a while that like every surgical case, right? If you were to put them into that bucket, it felt like there was a part of them that like didn't want to get better in a sense. And
Yeah.
that like whether they meant to or not, it was like because they
Right.
identified with their symptoms so much,
Yeah.
right? Like it was who
For
they
real.
were. And then from a surgical standpoint, a therapist standpoint, it's like, oh my gosh, how do
Mm.
you help them identify and see? Because they have to be an active participant in their own treatment plan.
And it's subconscious. That's the hard thing. A lot of these people don't know that they're looking to have issues or find problems because that's become their comfort zone, and they identify with that victim mentality. Yeah.
Well, it becomes a part, like you said, it's a part of their personality, right? It's like
Yeah.
who they are. They don't even know who they would be
Right.
happy, right? Like because what is happiness? It's like, it's this destination.
Yeah. It's true.
It's right. It's this place that you
Yeah.
need to go to, right?
Yeah.
It's a vacation. It's a day of the year or something like that instead of it's a mental state. And I
Yeah.
relate to that on a level like we have a big philosophy. The whole team knows like where your mind goes, your energy flows. Like
Like
and nonstop, right? Zig Ziglar. I'm always like, all right, guys, are we focusing on the negative or are we
yeah.
focusing on the positive?
Hmm.
And even in therapy now, I do so much more like posturing, balancing, body, like mindset shift before the therapy, because that was one thing in myo. And I don't know, I know you're working with a lot of myofunctional therapists, but like all good clinicians, we can tend to want to focus on one thing and they might get a little too focused on the tongue. Like,
Yeah.
don't get me wrong, it's a big deal, but there's so much more that goes
It's a
with
lot.
it.
Right. Yeah.
So I'm always like, you got to do some heart openers. We got to
Yeah.
stretch. We got to do posture. I'm like, let's get some
Mhm.
yoga going.
Yeah.
Um,
It's all additive. This
yeah,
is this is what I love about my functional therapists the most, though, because it's like, first of all, the function is pivotal. Like, even if I deliver a great structure and the tongue is misbehaving, the bite's going to change. The face is going to elongate again. And, what we knew as relapse before, it's not really relapse. It's just the malfunction is going to continue to put the jaws in the wrong position. This happens in 40, 50, 60-year olds, you know,
yeah, the issues are in the tissues.
the issues are in the tissue. So, it's so important. And I think it's been overlooked. Like, there's no myofunctional therapist in dental schools. I go to Columbia University, back to where I trained, and I love that school and I'm proud of it. But I go lecture there, and every time I go, I'm like, do you guys know what a myofunctional therapist is? And they still don't, which is,
No.
it's shocking because it's so important, not only for surgical patients, but every dental patient, every ortho patient.
Well, I appreciate you saying that. I started my career like literally cleaning dental chairs with a toothbrush as an assistant. And I always said every dentist I ever worked for, it was very clear to me that my job was always to make their job, easier, be their right hand, be
Yeah.
supportive, right? Like be that team player. And I'm always like, anytime I have the opportunity to lecture or speak, I'm always like, I know you guys want your job easier. Let me help you. Let
Yeah.
me do this for you. I
Yeah.
promise you, I'm going to make you look good. I'm going to set you up. I'm going to put this patient on a platter for you. Like,
Mhm.
please help me. Why do you think they struggle? Why do you think we're still climbing? Why is that like such an uphill battle, you think, in some of these medical schools?
Yeah, I think that there's a human behavior component where there's a lot of ego involved. You
Yeah,
know,
a lot of ego.
like, when you learn, these people went to school, became experts, and they stayed there and they teach as the experts. And it was nowhere. We just did. They didn't know. It wasn't part of their curriculum. Just like the airway was not really part of their curriculum. It's not something that was taught. So it's like now. they're the experts and they don't want to hear someone say that this is important where it was not part of their education or training to begin with. There's some kind of human behavioral block there that makes it hard to accept for some reason.
Do you think it's just they feel as though changing human behavior is not scalable?
I don't think so. I think it's really, I don't think it's that conscious or intentional. I think it's a
Okay.
real issue with the collective human mind where there's blind spots, and the ego is the enemy for sure. And the ego produces a lot of blind spots. And I think the higher you go in academic institutions, the ego becomes more powerful. It just drives that kind of person in these positions to begin with. So I think you see, you know,
Yeah, it's
less of
tough.
an open mind.
It's tough because I lived in Vegas for 6 years, and the reason we originally moved out there was I had this, opportunity. They invited I have a good, strong background in ortho because I was a very random my best friend who was an orthodontist said I was really good at selling cases, and he said, "So, I don't want you to do hygiene, you could just sell 'em." So, I had a really strong ortho background, but yet I had this ability for myo, and so I kinda got coined or niched the myo ortho specialist.
Yeah.
I always did myo around appliances. I've actually never had completed a case without
Mhm.
an appliance, which was a little unique for that space. So UNLV invited me over. I was able to speak for a little while at the pedo department, and it was the first time I realized that the pedo and ortho department weren't allowed, like, that we couldn't. I was like, "Can we just invite them over?" And you would have thought I asked, they were like, "No." Like,
That's of
and
course.
right, and then all of a sudden I was allowed to go talk to ortho, but I wasn't allowed to at pedo. And then there was a change in seniority, right? There was a new person, a new head of the department, and then after that, it was a no-go, right? The
Right.
philosophy decided to change. And it's not that I didn't know it was every aspect has political, but I really didn't realize. I think there was a little bit of naiveness to think, how come on, they can't be that separated, right? And so, but there really is separation in the specialties.
Yeah, totally.
And it's it's like we've almost like I keep looking as I was like, it's like everyone wears their loops 24 they
Yeah,
lose their peripheral. Like, I'm like, come
totally.
on, take them off. Let's all
Yeah.
kumbaya together. Let's have a little.
Yeah.
But there is definitely that, definitely that challenge. And the therapists, I know how passionate they are. They want to support, they want to help, but
Mhm.
there's a lot of fear when these docs kind of like shut them down and
Yeah.
tell them that they don't know what they're talking about. And then they kind of humble inside and then they get a little scattered.
Yeah, it's
And then
tough.
I think yeah, treatment planning gets a little messy.
Yeah, it is a tough position too because I know what you're dealing with. It's a real problem. Uh,
Yeah.
that's why I try to advocate as much as possible to normalize that it takes a village to treat patients well, and we all have so much to offer independently. And my job as a surgeon is to provide surgery, but I need a myofunctional therapist on board. I need a periodontist on board. I need a restorative dentist. And, when I started practicing that way, our outcomes became so much better. And it became so much more rewarding treating patients, knowing that we had a team of people that were very good at what they do, helping this patient out. And I think that it takes an abundance mindset
I understand.
to be that way. And unfortunately, most people don't have an abundance mindset. People are all trying to eat from the same pie.
I
And
know. I'm like, there's a lot out
they
there.
give
There's
too. Yeah,
Yeah,
exactly.
there's not a lack of it. I mean, what did I just say, right?
No,
Every city you are filled. I mean, there's plenty of people that need this support. They honestly, if anything, I think the bigger issue is that a lot of patients will come to by the time they come to you, they've seen 6 people
for sure.
and they're lost in the
Sure.
sauce.
Yeah, and it's one of those things. If you and I cloned ourselves and made 100 of each 100 of us will be busier than we are right now.
Without a doubt. Yeah.
The reason for that is because now we have something that's accessible and that message goes mainstream because we're just seeing a tip of an iceberg in terms of people that can access us and even understand that we can help, right? The 99.9% of the people that need our help or will benefit from our help have no idea and will never have any idea. So it's like that abundance mindset is like I teach a fellowship. I train surgeons how to do this. I go out there and I don't hide anything back. I try to share everything I'm doing online. I go to lectures and I speak to colleagues exactly the way I think and behave because the reality is that my biggest enemy is that there are not enough people doing this. If I had more competition, we would be more busy.
Well, it's Gary V, right? I love and Gary's like
Mhm.
old Jersey, and I
Oh,
love how he said, "Just
yeah.
give it away." And the
Yeah.
moment I had created just some simple like screening course, and originally the team was saying to charge it, and I said, "No, you know what? Just give it to everybody. Give it. Like, why should people let them all screen for it? Like, at least let them all talk about it and
Yeah.
screen for it." And I think we just need more of that mindset. And you're right. The mindset is absolutely everything, and anyone who ever tells me like, "Oh, you're always talking about energy or mindset," I said, "It's the foundation to everything we do, right?
100%.
Like,
Yeah.
without all of it."
Yeah. You also have to be born in the early '80s to understand this.
Yeah. Yeah, because 'cause you're right, if not, I have some other people later on, they have no clue what we're talking about.
But it
That's
takes
so
life
funny you say that.
experience to get there, you know?
Well, I think we are the last perfect generation in a way because, like, we
Yeah.
didn't grow up like, I still remember the kitchen phone, like, having to pull
Oh,
it, like
yeah.
and, I remember call waiting and all of all of those things that we still realize we didn't have access to information so
Right.
quickly,
Yep.
but yet, right, by the time we were graduating high school and getting to college, it was there, so we were just at an age where we still had to learn it, but we're old enough to remember what it
Yes.
could be.
Mhm.
Yeah, there's a bunch of little I well, that's a whole other podcast. I'll go down a road there
Fun one, I
about
like it.
yeah, yeah, where my feelings lie on that. Hiring, I will say staffing is I do a lot of leadership development
Mhm.
for like for especially female doctors. And I always say to them, listen, you have to get really strong in your own leadership style and who
Mhm.
you are because you have to lead by example nowadays. Like there
Yep.
is not who you attract will make or break your team.
Yeah.
Development, coaching and development and building aspect is so important to like
Yep.
businesses now. It can cripple you, right? If you don't have the right people around you. And it seems like that is one area you are doing quite well with.
Yeah.
Your whole team, everyone around you seems to be very dialed in.
Yeah, I'm big on this. We speak the same language. I talked about energy. We have morning huddles now that we really get that energy up. We practice gratitude, appreciation, and really focus on our operating systems and what our mission is for our patients. And all these things are really important. And it does start at the top for sure. I have to be accountable for myself so that other people can be accountable for themselves. But these two things have to be intentional too. And I don't think anybody really learns this stuff when they come out of their professional schools.
Well, because you're just like drilled, right? You're just trying to and then I think ultimately in general, which I'm a big advocate of like money's not a bad thing. Money's energy, right? We all need it. It's
Okay.
this what flows, right? Just let it
That's why
come
they
and
call it
go.
currency.
Exactly. And I think I talk about it all the time. I'm like, if you're afraid to talk about money, you have an issue with money.
Yeah,
Like
sure.
and we all have it. Our grandparents it comes from lineages and different things. It's nothing to be ashamed of.
Yeah.
But if you can't get real clear about that, and that was a big thing I had to work on was
Mhm.
what was success. If your only adaptation of success is the financial return, you
Right.
will always run a little short. It will never feel fulfilled. And then ultimately that will trickle down and that will leave a not a great taste into everything. And the moment you can shed that and release that, the ability to expand is just
Sure. Yeah.
mind blowing.
Yeah.
I
It's true.
mean, yeah, and I even say that with health with patients, right? Like
Mhm.
if we can just help support you and get you out of that place where you're like hyper focused right now
Yeah.
and I can just shift you right over here, it's
Mhm.
so different and now you can start to release because the tighter you hold on to something, the more likely you're going to
Um,
lose it.
yeah,
Right.
100%.
So,
And it's real. It's at a cellular level. You know,
mhm.
when you complain, your cells will drive inflammation. And then, from a surgical side of thing, I see this all the time. I see the positive mindset and I see the negative mindset, and their sutures will hold differently. Their wounds will close differently.
Mm.
How fast people recover physiologically is differently based on what they're saying to themselves and the people around them. So I try to stress it all the time. And any patient that says, "Okay, give me your advice before surgery," I was like, "Stay positive, because if you stay positive, you're going to heal. Let the doctors worry about your recovery and guide your healing. You don't do that. You just stay positive, because that's going to impact what's actually going to happen in your recovery." And I've seen it clear as day.
Well, and I think it's almost slightly naive to think that our thought process doesn't affect the monkey suit that's all connected. I mean,
Right.
it's
Yeah,
one beautiful system,
it
but
is.
I think in general, a lot of us rely so heavily on the brain, right? Like this
Yeah.
input output, that we do sometimes forego our intuition, that gut instinct. And I
And
can speak of this. I suppressed it with food for a really long time. I didn't want to feel what I was feeling in my gut. So I would try to stick it down. And then if you're tired, sugar, all these little aspects of things that were just suppressing, that I had all these feelings I just wanted to to come
yeah,
out and say. And I can see why then my body could only hold on, and I how can that not affect the outcome of healing or
absolutely.
surgical approaches. And I have so much more empathy now for patients. And when we teach therapists, that's my mission and my goal is like
Mhm.
I want nothing more than a bunch of little light worker myofunctional therapy just doing like energy work and tongue exercises for
Yeah.
all,
Yeah.
because I don't know. I mean, I know the therapist will kill me if I don't ask you, right? Because they all want to get clinical.
Yeah.
What exercises do you want done, pre and post surgery? My answer always to them is just listen to the body and watch what the patient needs. But is there anything, certain things that you have noticed with some of the therapists that you're working close with that maybe help move the needle at all?
Yeah, I think the most success I see, the guidance from a therapist, or with tongue. We talked about tongue being important. I think it is very important. Yeah, it's not the only thing, but I think
Yes,
what
yeah, and I don't mean to take away. Obviously,
yeah,
it's a very, very strong
and
group
I
of
know what you
muscle.
meant by that.
Yeah.
Yeah, I knew exactly what you meant by that. But before surgery and after surgery, to have the therapist really help the patient understand where that tongue needs to be, and strengthening that tongue position to be in the right posture, I think is really critical.
So same thing, making sure that we have good like decrease in compensation, that the patient's able to hold and maintain the tongue on the palate of the mouth without having to really rely on the mandible, the excess muscles, a
Exactly.
lot of that jaw shifting, right? All of those things. So that's pretty in line with just making sure. I always say you don't want the tongue and the mandible to act like Siamese twins, right? Like they
Right.
need to
Exactly.
they need to work separately and be great together at the same
Yeah.
time. Well, you're a twin, right? Is that the
I'm him. Yeah. That's
that's
exactly.
ex you guys are the same but different.
Yeah. Same, but
Um,
different.
and then what
Nasal
about
breathing, and
nasal
all,
breathing?
all the things that you guys do to promote nasal breathing and lip competence, I think are really important.
Chewing and swallowing after or before, do you find that to be a real big area, I'm assuming? I mean, I know that was when you guys were wiring the jaw shut and all
Right.
that stuff.
Yeah. Not so much. I mean, it's important, but I feel like you're right. Now that we're not wiring people shut, I don't see swallowing really as an issue. And chewing, I try not to have patients chew for the first 2 to 3 months. I usually say 2 months strict no chew. After 2 months, pancakes and muffins, and then the scan looks great, and I'll clear them after 3 months. Then I say ramp it up, and at that point, I like to have the myofunctional therapist really help them understand that all of this has atrophied, right?
Mhm.
The muscles are weak because they haven't been in use, because they've been stripped off the bone. So even if the bone is ready now, it's going to take time to strengthen your chewing muscles. So working on those things, I think, does make a difference too, and just helping patients understand that this is a rehabilitation.
Which is great because we teach a really new kind of philosophy for the therapist, and we've been working hard around surgery of this activation, integration, and stabilization, right? So
Mhm.
in the beginning, activate the muscles, build awareness, then maybe phase out, give them a little break, check in, and then you kind of come in, integration, figure out where they're at, whatever their appliance situation is. And then on that back end post op, really go to the races of muscle rehabilitation and then
Right.
really get them into a strong, stabilized state. And now we do a lot of posturing. We have them working on posturing boards, bringing in their breathing component, and
Yes.
really just like elongating and stretching from a place. But at the same time, even if they can't chew, there's a lot of things they can do muscular in their body that won't strain that between nasal breathing,
Yeah.
activating and the feet and things like that. So
Yeah.
um
And then
yeah,
one
it's
a very important thing that may not be so obvious, but that T in OMT, yeah, it's you guys provide so much mental therapy,
mm, we
which
do.
which is really important because it's a there's a lot of changes that are happening after surgery. Physiologically, it's a big insult to the body, and it's stressful, and there's anxiety around that. And
That's
then
a really Can we just go touch on that real quick? That's a really powerful, beautiful way to say like that it's an insult to the body because it's changing, right? Like you're changing how it worked or what it did, right? In a sense.
functionally, and then even people look different, and even when they look a lot better, sometimes if someone had a very weak jaw their entire life, even though they look awesome, it plays a trick on the mind. It's hard sometimes for patients to look in the mirror, and a lot of them struggle with their identity too. So there's a lot that goes into it when we say insult. There's the functional part of it, the healing part of it, and then there's that mental part of it. And to have someone on your side, which you're seeing parallel with the surgeon, parallel with your other providers that are checking in on you regularly, having awareness of what patients are going through. You've seen you're rehabbing multiple other patients that have gone through surgery, and you're putting in the reps and 10,000 hours of understanding what these people are going through, and then that confidence, I think, really helps them when I'll have patients come back and say, my functional therapist said I'm doing so much better than everybody else at this stage of my thing, and then it encourages them in
Hey,
terms
that mental yeah, we all need that
of
cheer,
where
right?
they
That's
are, right?
right. We need that cheerleading. We need that coaching, right? I
100%.
I actually kind of go just real quick on what you said on that therapy side. I always say you are really their coach, right? You
Yeah.
are like, so that's why I'm very aligned with your basketball, with everything like that. It's about coaching and how good of a coach are you? How can you
Yeah.
meet people where they're at, develop them, support them, and
Mm,
then inspire them, right?
yeah.
Inspire them to want to keep going during the worst part of it, like when they want to quit.
Hmm.
You got to come in and keep that motivation going.
Yeah.
And I think that's where the motivational portion of any type of therapy matters.
Yeah, it's huge. And Johnny, my brother, talked about that. He had a pretty uneventful recovery. And he even said, he's like, I can see, in that first month, how this can take a toll on them psychologically. Like there is some struggles to get through, and you gotta really be a strong person, have a good mindset. So I think all that support, it's critical. And again, these are things that we never even considered or looked at, and still a lot of people don't. But we're trying to normalize this as much as possible because I think it's going to make surgery that much better and easier to get through if everybody's on understands these principles.
Well, I'm quite confident that if we have the growth that we've had in these last 10 years and the next
Yeah.
10 years, I think, we're going to be in a much better position than we even are today. And I always say we are light years from where we
Exactly.
were right? In
Yeah.
2013,
Yeah.
14, even 4 or 5 years ago.
I mean, I
So
look
we're moving
oh,
the right direction.
totally. Like we'll look at, I have patients now that they're doing great. They're 3, 6 months out of surgery, and we're looking at little scar bands from their mucosal incisions and sometimes releasing them because they're restricting good lip posture and all these things. But I look at these things and are like, this was nowhere even on our radar
Before. Yeah.
before. Like we're
Are
finding
you
things to a very high level now.
are you doing tongue tie releases as well when you're doing the like, are so
Usually I like to do it 3 to 6 months after
okay,
surgery. I don't like to do it before, and I don't like to do it during. One, because they don't have the room beforehand.
makes sense.
Their airways already collapsed, and their tongue is already weak. So if we release it, I'm worried that their tongue is going to collapse more on their sleep.
And
So
make their symptoms worse, obviously,
make that,
yeah.
so I don't like doing it before. Early after surgery, for it to be successful, they really have to be able to rehab that tongue and use it in the right position, which means that they have to be far enough through surgery and myofunctional therapy where their range of motion and opening is appropriate, their muscles are strong, and they've worked on their tongue to have some strength so that when we do the tongue tie release, they're going to have success rehabbing it.
Well, that makes a lot of sense. We talk a lot about tongue space and making sure the tongue has enough room and that it can function. And
Mm,
again, right, with really good therapy and good muscle control, you can make a lot of headway
for sure.
just by changing the way one is functioning and ultimately just bringing awareness, right? Like just
Mhm.
a lot of times you just have to show people they have a problem and they can usually start making some changes if they want to, which
Oh,
makes a big yeah,
yeah.
difference.
Even if you take surgery out of the equation, there's so much you guys can do to help people. You know, I think about myself before I was a mouth breather
You were.
for sure. And then talking about it, preaching it, I had to work on it. Or now I'm a nasal breather, and I nasal breathe at night. But it took work to do that, but it's helped a lot. You know,
The
I'll,
power of awareness, right? Of just
I
being
was
able
honest. So something as simple as training your muscles to behave appropriate, getting your tongue in the right position, minus surgery, people can get a lot healthier and have a lot of benefits just working on, you know, oral posture.
yeah, which is just again goes back to the power of the muscles and power of mindset and what you can do if you put your mind to it. You
Mhm.
really can make big changes. Obviously, structural changes are needed. Sometimes you can't, you just can't outfunction what happened to the structure originally
Right.
and that's okay. And as as we round here, is there any like major like kind of advice or if some family members come and do about early intervention with kiddos, right? Like,
Mhm.
you know, somebody young, fix it before 6 or whatever, but are there appliances or protocols or techniques that you tend to kind of think, "Hey, I kind of like where that's going," or that you tend to lend to?
For sure. I mean, I have 3 young children. 2 of them have had expanders already. All 3 of them do myofunctional therapy, and I think that those 2 things, the earlier the better. You
So
know
when you talk expansion now, especially being in the 3D printing world,
Yeah,
and the moves and the leaps and bounds we've come with 3D printing even in the
yeah.
expansion space.
Mhm.
I just said to somebody, I'm like, "This 3D printing, it's like the Spanx for the mouth. I mean, this thing fits like a
Yeah,
glove."
nice. Yeah. No, it's
Like, it's
amazing. I
so
mean, if you
good.
for parents out there, find either a orthodontist or pediatric dentist in your area that's treating kids early, looking at
Yeah.
tongue ties, have myofunctional therapists that they refer to or on their team, can expand with functional appliances. The earlier you have someone accessible to you that can do it, I think amazing things happen to these kids. They can grow. If you can start at 4, 5, 6, even at 7, 8, 9 years old, it's not too late. A lot of good progress can be made. I didn't
I
start,
appreciate that's really great to hear you say
yeah,
because there's that camp, "Oh my god, I waited," and I never want parents to
never.
feel like they waited too long. You're whenever it happens, it's perfect
Yeah, whenever
timing for you.
you didn't know before, but now you know now. Even if your kid's 14, there's see a myofunctional therapist. They'll help you get in the right direction. Nowadays, you can do MARPs and expand people pretty easily, especially at that age. And then
Yeah.
surgery is an option for people if they need it.
Well, I can't tell you how much I appreciate what you're bringing, just you getting outside your comfort zone, or if it was your comfort
Thanks.
zone, or yeah, and just putting out the content and just moving the needle, and it's really making quite a difference. It means a lot. We have a little bit of a thing we do here at the end of most of our podcasts, and I always ask the guests, like, what does like mind your mouth mean to you? And what would you like move forward, right? Hand off to the next person.
Yeah, mind your mouth. Well, when I hear mind your mouth, I think about oral posture and, not taking for granted how important the muscles around the mouth are. So you have your lips closed right now. You're breathing through your nose. I think just being aware and minding that is so important. I always say that we talk too much here. That's part of our culture. Our lips should be closed more.
I'm gonna bring my kids in a minute so we can remind them. I my son is a lot like me, and I always tell him, I go, he goes, "I have a lot to say." I go, "And I really don't want to hear it." I go, "You should really close your lips." Well, Dr. Alfie, I can't thank you enough. And for everybody listening, we're going to put all of your info in the show notes and tell everybody if you guys are not following or not watching his podcast or following on Instagram, you are absolutely missing out. And I sure hope this is not the last time we meet. I'd love to come over to Houston and come check out
I'd
and
love to have
do
you on
some.
the podcast. Let me know when you want to come.
Yeah, I
Let's
would love to
continue
come
this
on the podcast.
conversation. Yeah, it'll be a
Yeah,
lot of fun.
any reason to come to Houston to do some regular shopping, I'm all about. So, again, thank you so much. Really appreciate it.
Yeah,
Thanks,
thank
everybody.
you.
Till
It's a
next
pleasure.
time.